Desmond Mackenzie, Minister of Local Government and Community Development. I want to also recognize the usual suspects, if you will, the Chief Medical Officer, Dr. Jacqueline Bisesa Mackenzie, and the Permanent Secretary. All right, so today we are in usual form. We will go through the regular updates on where we are over the last 24 hours as it relates to the COVID numbers. Beyond that, we're going to have an interview with the Jamaica Medical Doctors Association's president, and we will have the National Health Fund CEO online also. And then that will be very brief, and then we'll go into Minister Mackenzie's presentation. Minister Mackenzie, of course, and his portfolio are absolutely critical to the COVID response. He has been a key player, his ministry, his team, in the many hours of planning to deal with this issue, and very diligent and committed to that process. And of course, his portfolio takes us to the communities where the bars are, where the shops are, where the attractions are. It is his portfolio responsibility that includes giving approvals for these activities, and it is his portfolio working with our municipal corporate councils, the parish councils, if you will, to use a term that no longer is official, right? There's one, but people understand, and councillors to help in the community response, the permits for people to operate, and if there are issues, how do we respond to that? How do we manage the surveillance at the community level? We cannot, public health alone, do this community response. Minister Mackenzie is key to that, and he's going to speak on some of the latest developments, but also give his overview. After which we'll entertain questions. We promise you we won't stay with you more than an hour and a half maximum, depending on questions that come in. All right, so the current case numbers are as follows. 2 new samples have tested positive for COVID-19 in the last 24 hours. So that's 2 new samples, which is a reasonable number. The total number of confirmed COVID-19 cases in Jamaica, therefore, stands at 765. That's 765. The new cases are imported cases having arrived recently on flights from the USA. One is Jamaican from St. James. The other is a non-Jamaican who stayed in St. James. This tourist has since repatriated. There are 2 males, one 24 years old and the other 40. In the last 24 hours, 28 more patients have recovered from COVID-19 and have been released from isolation, bringing the total number of recoveries to 675, or 88.2% recovery rate, which we have to be proud of as a country, as a people. 88% recovery, which means we are managing the process and Jamaicans are responding. 24 or 3.1% of patients were repatriated to their countries of origin. And there are now 56 or 7.3% active cases currently under observation. So 56 persons under observation, active cases. And always good to have this number. There are no critically ill or moderately ill patients at this particular time. And that is good because it means hospitalizations are not as serious as if we had critically ill patients. The 765 cases are classified as follows: 247 imported cases, 238 cases that are contacts of confirmed cases, 44 local transmission cases not epidemiologically linked, 236 related to the workplace cluster in St. Catherine. Investigations have concluded for the 7 persons under investigation and the case reclassification reflected in the breakdown above. Of note, 5 cases have been classified as local transmission, not epidemiologically linked, and 2 cases as contacts of a confirmed case. The gender classification, 429 or 56% females, and the rest 336 males, and ages ranging from 2 months to 87 years. In terms of testing, an issue that I know will come up, and I spoke to today at the National Public Health Lab official handing over of new equipment. So far, we have had 29,443 samples that have been tested, with 28,618 negative and 60 pending. In the last 24 hours, 484 new samples were tested. In terms of isolation and quarantine, there are 56 patients in isolation. That's 56. 3 persons of interest are in quarantine at government facilities, while 17,776 are in home quarantine. And I think it's important to note that the home quarantining or stay at home is the big focus, because we're moving away from institutionally quarantining everyone, which means community surveillance, community response, which is why Minister Mackenzie is here. 17,000 and odd persons are in their homes under stay-at-home arrangements, and if they breach those arrangements, it could have a lot of implications, and I think it's important that we recognize that. It is now more important than ever, in conclusion, that Jamaicans remain vigilant in their infection prevention and control measures to reduce the risk of exposure to COVID-19. We cannot afford to be complacent. We must take personal responsibility to protect themselves or ourselves, our loved ones, our community, and our country. I want to reiterate again, COVID-19 is not over, and Jamaicans must persist in measures such as maintaining a physical distance of 6 feet from each other, wearing masks when physical distancing is not possible, such as in crowded situations, and the mask wearing is more observed, it seems, in its breach than its observance, to use a term from Shakespeare, and this is not acceptable. So we're really appealing to Jamaicans to get back in that habit if you have lost the habit, because COVID is still a keep. COVID is not over yet, and the dangers are still very much there. Avoid crowds, stay at home if you have the option to. Frequently wash hands and sanitize hands and clean surfaces where droplets may have fallen. Obeying quarantining and isolation orders as given by the public health authorities. And as I said, and as we have said continuously, everyone has a part to play with the efforts of our hardworking healthcare workers across the island and the cooperation of every Jamaican. We can beat COVID. We've been doing a good job so far, but we should not get complacent, because COVID, as I said earlier, still a keep, and the risks are still there. Our closest neighbor, the United States, our closest and most active neighbor, you've seen what is happening there, and that has implications for persons coming in, which is why we have so many home stays, and which is why the community approach is so important. So in closing, 2 cases today, and we have no one critically ill, no deaths, which is good, and we continue to monitor the situation. Now, I want to turn to an interview quickly with the president of the Jamaica Medical Doctors Association and the CEO of the National Health Fund. But before I ask them to join in, I want to just make a brief statement. As you know, over the past week, we have had conversations around the lack of employment opportunities for our doctors who are just completing their senior house officer stint and are now certified medical officers. And the JMDA has indicated that just over 100 or so of their members who are now medical officers have not found a space in the public health system. And understandably so, it has been a concern by them and certainly by the public, because the public health system is under stress and we can always use additional capacity. The challenge has been, of course, the spaces, and it's something that we met with earlier this week and had a conversation on. Last evening, I appeared on a TV program on TVJ, and there was a discussion which took place, and I've gotten some feedback after the discussion that my approach to responding to some of the concerns of our medical doctors came across in a way that could have caused offense. And I want to just use the opportunity to unreservedly say to those members of the medical profession who have expressed concerns, whether of working conditions or otherwise, that I apologize to them for that interpretation or the offense that may have been caused. It certainly wasn't intended. I have long indicated that our public health professionals, doctors, nurses, and the supporting administrative team have done outstandingly in terms of responding to health-related threats in our country. We are internationally known, certainly as it relates to all sorts of responses, but certainly in the medical field. And, I have the greatest respect for our clinical or medical team and our medical officers and those who have invested time and effort in preparing themselves to offer this kind of service. I also appreciate the concerns that they have and the concerns that were raised. And I don't want my approach last evening to be interpreted otherwise. We will work together to do what is necessary to correct some of those ills. Many of them are long-standing ills. And I want to say again, there was no offense intended, and I hope we can move on from this and work together to advance the cause of good public health in our country. So with that said, I want to introduce the President of the Jamaica Medical Doctors Association, Dr. Elon Thompson, and Mr. Everton Anderson for two reasons. Well, first of all, gentlemen, welcome to our digital press brief. Are they online?
Thank you very much, Minister.
Okay, thank you very much.
It's a pleasure being here.
Great. There are two things that I want to raise quickly, and I really appreciate the time on. Dr. Thompson, one of the issues that was raised by your association, you were there, is the lack of space to absorb your members who are now seeking to be engaged in the public system, having completed the Senior House Officer program. We did commit to following up with the Ministry of Finance and to see, firstly, where there was a need, and secondly, if we could get additional positions. And I'm happy to report that having had those discussions over the past day or two, the Ministry of Finance has said that we can find a way, and we are working to find a way. And there's a meeting tomorrow morning to try and concretize the opening up of more spaces. I'm not going to promise 100 plus, but certainly substantial enough to fill some of the gaps that exist, and of course to put some of your members to work in badly needed areas. So I just want to say here first that we have made some progress, and I think it will bear some fruits tomorrow, and we will fill you in on that tomorrow. But your thoughts on some of the issues, I wanted you to get an opportunity to just ventilate some of the concerns you have, and if you want to comment on what I've said.
Well, your last few statements, Minister, demonstrate that the government is trying to work through a way for the doctors. I'm quite encouraged by the statement. You know me, though, I like to see results, and we look forward to the spaces that we can get. Hopefully it can be a substantial amount. The needs are there, and the persons are still in great need. I hope public can understand the situation that the doctors are in. We know that there are other persons out there who are unemployed and are in a similar position, but I say to the public that please understand that we are working in a system that can really use doctors to really have a more efficient system for you, the public. So, for whatever period of time that they are allowed to work, then of course they now have a responsibility to demonstrate to the public and to justify the government's response that has been given so far, at least in the commitment that is made, Minister. And I'm happy to hear you say that this evening.
I appreciate that, and I assure you that the team at the Ministry, Permanent Secretary PS, myself, and others are committed to finding solutions to the challenges. We are stressed in public health, And to the extent that we can accommodate more, just to note that the longer term strategy, of course, is revising the entire structure as we discussed in that meeting. And the CMO has committed before the end of this year to present to your association the new plan for capacity building. And I think that will pave a way for a longer term, more permanent arrangement as it relates to additional posts. And I hope that is understood by your members. The other thing quickly I want to bring in, Everton, was raised last evening was the issue of drug shortage. And I know that I'm quoted as saying there's no shortage. And I did say that, but I said it in the broadest sense of the word. I'm sure from time to time shortages exist. But I wanted Everton to just give us a minute or so as to the approach to procuring or securing or sourcing drugs and his own interpretation around the drug shortage claims. Everton?
Right, thank you, Minister. I start by saying that across the globe, there are always issues in drug availability due to so many factors, global shortages, discontinuation of products, product recalls, and with COVID-19, there will be certain other issues that would create uncertainty in the market. But within the context of that, I want to say that our team has worked hard to ensure that most drugs are available to our clients. In fact, our fill rate over the last few months has ranged between 86 and 90%. But there are specific items, certainly, that we would struggle to get. India was on lockdown for months, and we procure a significant number of our drugs to India. In fact, our procurement is from 80 different countries. So there'll always be challenges from time to time. If you check the US FDA site, at any point in time, they'll have a list of items that across the globe may be unavailable. But our team has worked very hard to ensure that the facilities have adequate stock most times, and we'll continue to do that.
If I may be permitted to say something, Minister.
Yes, of course. Go ahead, quickly.
So I want to encourage the public to understand that it is, well, my personal belief, I may not be speaking for the JMDA per se now, but it's my personal belief based on what I've seen that NHF is one of the best run government organizations in the country. If we look at the time it has taken to even get a NHF card, that time has been significantly decreased. Before it was being mailed to you. And now when you go to the NHS, you can get the card in about 15 minutes, 10, if you are, if it's a good day. I can say categorically that since the NHS has come on board in the hospitals, the availability of drugs has gotten much better. I'm not for a minute saying that we have all drugs available, but we have to look at what happens between NHF and it coming to the hospital. So the hospitals have a duty. The administrations of the hospitals have a duty also to make sure that they really keep up to date with what the NHF has and inform the staff if there are any shortages. So the hospital administration has a responsibility to demonstrate where there may be shortages and how long it is going to take for drugs to come back in being available. So, I don't want the impression to be that, the NHF is not doing what it's supposed to do. It has a responsibility, yes, and I don't want NHF to get complacent because so far they have done very well in transforming the pharmaceuticals in the public health system.
Thank you for that endorsement for the NHF on behalf of Everton and the team, Dr. Thompson. But Everton, what I discern from what is being said by the president of the JMDA is that perhaps a conversation needs to be had at the level of the regions and by extension at the level of the hospitals, because you may be pushing the drugs or making them available, but because of the management flow. But isn't it true that NHF controls the pharmacies now in the hospitals, and therefore your own people would be required to keep themselves abreast as to what
are being prescribed? So when a patient comes to a pharmacy with those items on a prescription, they are not available because we actually do not provide these drugs. So that's also one of the issues that may affect the perception of mass shortages. But we'll continue to improve, and we have already seen great results because I think last year we filled a record 2.68 million prescriptions, dispensing again a record of 6 million prescription items. But we recognize that we have to always improve in this area.
Okay, thank you very much. Any final word, Dr. Thompson, or if not?
Well, I'm hopeful for the doctors. I'm very heartened by your remarks today. And we'll continue to work together. The JMDA stands ready to work with the government wherever we can and to serve the public. So I am heartened by the fact that there is hope for these doctors who are unemployed.
Thank you very much. Thanks a lot for joining us. Thank you, Everton, and all the best.
Yeah.
And we will continue to have the dialogue. Thank you.
All right. Take care, everybody.
Okay, so we now turn to my colleague and friend, Minister Mackenzie, who is the Minister of Local Government and Community Development in the context of new openings, new freedom of movement, new activities, but greater community focus. I'm asking Minister Mackenzie, we invited him to share with us where from here and how he sees his own role in this approach. Minister.
Thank you very much, my colleague and friend, Minister Tufton, CEO, Permanent Secretary, and the viewers both on radio and television. Good evening. It's a pleasure to be sharing the platform with Minister Tufton this afternoon as we are now moving in a different direction in our response to COVID-19. First of all, I want to use the opportunity to commend Minister Tufton and the team, the CEO and the Permanent Secretary and the full complement of the Ministry of Health for a fantastic job that they have been doing, keeping the country informed and also providing the kind of leadership in terms of the medical expertise that are required. The Minister spoke about the community activities, and we are now at a stage where we are opening up the communities. And when I say opening up the communities, we are now starting to go back to the CMO. Thank you. We are going back to the community activities across the country. We made some announcements in Parliament on Tuesday, which speaks to a raft of initiatives to reopen on a gradual basis certain activities across the country. But I want to make the point, and Chris did so in his comment, and to say to the Jamaican people that the easing of these restrictions is not a passport to run wild. And there are many Jamaicans who are saying that COVID now keep again. And that is a major, major mistake. So it means that whatever decisions the government took on Tuesday and whatever decision the government will make after, it means that there has to be that level of personal responsibility that is demonstrated by many Jamaicans. I know we have the capacity as a people to respond, and I am very, very confident that they will do so. One of the initiatives that we are working within this join-up approach in government is for the Ministry of Health to work closely with the municipal corporations. Minister Tufton have started a series of meetings with the municipal corporations across the country, sensitizing them to the various issues and to seek their full participation. I want to give the country the assurance that all municipal corporations is on board in this fight as we open the economy and as we try to encourage the community. The Social Development Commission, which is the community arm of the Ministry of Local Government, is very much involved on the ground in the various community activities. all of the sensitization in terms of the information that was used to develop the protocols was undertaken by the Social Development Commission, and they will be an integral part of this community-led program on the ground throughout the country. I want to touch quickly some of the areas that we announced to have reopening in Parliament when I spoke on Tuesday. I know that the entertainment industry is a vast industry. It represents a significant portion of livelihood for many Jamaicans, and many persons in my own constituency and in sections of your constituency and right across the country. They make a very good livelihood from entertainment. But the entertainment comes with a risk. The protocols that we have announced was not just developed by the Ministry of Local Government or the SDC, but we have had extensive discussion with the players in the entertainment business, working with Minister Babsy Grange through the Ministry of Entertainment and looking at a wide cross-section of the industry. And we met for over 3 consecutive weeks, and we arrived at some positions which I think is workable. So what I announced in Parliament was just not an initiative coming out of local government, but it came out of those extensive discussions with the promoters. And we spoke about events commencing on the 21st. Outdoor events, which would include tailgate, concert, parties, round robin, religious celebrations, festivals. And in all of this, we speak about the protocols that has to be observed, observing the limitations that we place on the number of persons that can be in a venue at any one given time, observing the protocols in terms of the health aspect of it, which is going to be very, very important. And this period that has been offered for the entertainment sector, for the gaming industry, for the water attractions, for summer camps, for daycare, after the 2 weeks, when that assessment is done. And let me tell you, this is not just talk. We are putting out there over 2,000 persons to be working within the communities, monitoring the various activities. And they are not just going to be monitoring the activities. They are going to be making recommendations, and they are going to be a part of that wide core of community-driven activists, if you want to use that word, that will be out there passing on the information that is going to be required. So in short, the government have listened, we have heard the cry, but we have to be responsible in what we are doing. And that level of responsibility is vested in that wide constituents of Jamaicans who will benefit out of the 6 areas that I announced that will commence operations on the 21st, Chris.
Okay. Thank you very much, Minister Mackenzie. Appreciate that overview, and he's available, of course, for any questions. CMO, you have anything to comment on before we go into any questions? Testing, let me just say that today we had a handing over between the AEIA, the International Atomic Energy Association. I got it. Professor Charles Grant of the UWI representing that entity out of Europe, and the U.S. Embassy represented by the Ambassador Tapia, and CDC, where a number of testing equipment were handed over to the National Public Health Lab, and that will boost significantly the capacity to the lab. I did announce today at that function, and let me say it here because I think it's important that we are transparent, that we do have a backlog of tests, nearly 10,000. That is as a result of the significant increase in numbers coming in, but very importantly also a result of a shortage of testing material, reagents or test kits. There is a commitment to complete that level of that backlog by the end of this month. And hopefully with the new equipment we had today and some new arrangements, we'll be able to manage that process better. I want to reiterate, however, that testing is only one of several surveillance methods. And while we regret the backlog and we apologize to persons who may have been waiting longer than normal, we are doing all the other things that are important and require of you to do certain things, particularly around the community stay or the home stay. And I want to just raise that. So today we had a good boost in our capacity. CMO, you want to add anything before we go to questions?
Right. Thank you, Minister. I would just want to reinforce our commitment as a Ministry of Health and Wellness to improving the working conditions for our doctors, including, of course, improving the doctor to patient ratio, and also to stressing the need for improved supervision of the doctors and improved working conditions, and also to look at the social infrastructure to get our doctors to work in the rural areas where they're really needed. With regards to the opening up of the different entities, again, I would want to stress to Jamaicans that they must have that personal responsibility that to ensure that they prevent and stop the spread of any COVID transmission. So anybody who is sick needs to stay home. Persons need to adhere to the infection prevention and control measures, maintain physical distancing, wearing a mask where they're in a crowded situation where they cannot maintain that 6 feet distance, and of course hand hygiene, wash hands, hand sanitize as often as you can, and also respiratory hygiene to cover coughs and sneezes.
Thank you very much, CMO. Okay, so that's it for this segment. We go to questions now. Stephen.
Thank you very much, Ministers and CMO. We're just inviting our media colleagues to use the raise hand feature on Zoom to ask your questions. We're beginning to take your questions now, so you can use the raise hand feature and we'll acknowledge you to ask your questions. We're going to go to 18 degrees north.
Hi, good evening, everybody. My questions are for Mr. Bryan. Is he there?
Yes, he's here.
Yes, you can go ahead, Zara.
Okay. Last week, there were some statistics or expenditures that you went over, and we didn't have a real chance to get into the figures as much. So today, I'm asking questions related to that. I wanted to ask about the $262 million COVID-19 budget for risk communication and community outreach. Can you give a sense of whether any of that budget was spent at a consulting firm, Market Me? That's one question. Question two, did you sign off on any payments to Market Me over the years since you've been the permanent secretary and during COVID-19? And if yes, were you aware of these allegations circulating on social media that Minister Tupton may have been connected to the principal?
Okay, all right. So thank you very much for those questions. So with regards to the first question, yes, the Ministry of Health and Wellness, as part of its communication strategy for COVID-19, has utilized Market Me, the consulting firm, to facilitate our communication strategy. And regard your second question, as permanent secretary in June of 2019, a contract was awarded to Market Me for the sum of $38,931,820. And that contract was approved by the Public Procurement Commission on May 9 of 2019 and was therefore duly um, duly vetted through the procurement process of the government of Jamaica. In terms of whether or not I was aware of allegations at that time, of course not. That's not a part of our business, in our business process in the Ministry of Health and Wellness. We do not interrogate rumors or innuendos or any sort of allegations of any sort of relationship. That's not our modus operandi at all, and that is not part of the process for the procurement that we undergo according to the law.
Thank you very much. I'm going to go to Edmond Campbell.
Thank you very much. P.S. Don't move yet. Just I was Zara has actually asked one of my questions, but just a follow-up to one of the questions that Zara asked. I did hear you say that the contract went through the procedure. Just for confirmation, it was put to tender.
So to answer that question directly, to answer the question directly, the contract was awarded to Market Me through the direct contracting method under section 1.1.4E of the Handbook of Public Sector Procurement Procedures, and the justification for the award of contract using this methodology was it was a continuation of a previous contract that was awarded to Market Me in December of 2016, and therefore it was awarded using the direct contracting method.
Thank you very much, PS. We're going to go to Emma Lewis.
Hi, good evening, everyone. I just had a quick question about home quarantine. How is it working? How are you managing to monitor and conduct surveillance on, well, getting on for 18,000 people? It seems like a daunting task, and I'm wondering really how it's going. We've all heard stories about people breaking home quarantine or anecdotal stories, but I'm just wondering how you're coping with that.
Thank you so much for that question, Emma. Of course, managing 18,000 persons is a lot. And we have stressed over and over in this press briefing personal responsibility. But not just personal responsibility, but everybody's responsibility to really enforce the home quarantine. Ministry of Health really and truly does not have the kind of manpower to police everyone, and we really shouldn't have to police everyone, because we've been talking about this COVID-19 from January of this year. The public is sensitized and the public is aware. The public sees the news reports, what's happening globally, and they understand the risk. They also know when their relatives, their friends have returned and are in their homes. They have a responsibility to ensure that these persons stay home and do not leave the house until the 14 days are finished. So it really has to be an everyone's approach, everyone's responsibility. It's not just the Ministry of Health. We do, however, rely on persons to call us when they do develop symptoms. Now, when they develop symptoms, that's when we step into action, because these persons now have to be tested. Again, if they were tested before, they have to be isolated if necessary. They are family members. We have to do the contact tracing. Persons need to be put into quarantine. But it depends on people calling us. We don't want anyone to be at home with symptoms and do not call. We have enough capacity to manage that. And so persons must call the Ministry of Health using all the different methods that we have to trigger this action. What we really need persons to really participate in is the management of the persons that are without symptoms. I hope that answers your question.
Can I just follow on that, because I think the messaging around everyone counts and taking individual responsibility is so key. I mean, we are engaging, as we had said, an additional 1,000 or so community health aides. In the past week and a half or so, I've been visiting with some of those persons in the Western Jamaica and in St. Catherine, where the training is actively taking place. And they are going to be deployed via the health centers into communities, and in particular, vulnerable communities, in order to be the ears and eyes on the ground, to provide information, to gather intelligence, to continue to encourage and motivate. And they will become the sort of COVID army, if you will, in the field. But I want Minister Mackenzie just to comment briefly on the fact that there's going to be a multi-agency approach to this surveillance and information gathering. And the Ministry of Local Government and Community Development has a team. Ministry of Tourism has a team, but I'd like Minister Mackenzie just to expand a little on his team.
Well, what we are doing, as I said earlier on, is going to be putting over 2,000 young people right across the country, complementing the team that you have, and also working closely with the Ministry of Tourism in the question of surveillance and information. Now, this team would have already been out on the field, because a significant portion did the surveys on the bars and the necessary assessments across the country was done. So they have an insight as to what is required of them. There's a template that has been already established, and the additional training with the Ministry of Health team will go a far way in strengthening the capacity of the Ministry of Health to respond to the whole question of monitoring. Later on next week, when I speak in the sectoral debate, Chris, I will be making some further announcement as to the Youth Summer Employment Program, which will also go far to boost the team that will be out on the ground to assist in this process.
Thank you very much, Ministers. I'm going to go to Afia Saunders.
Hi, good evening. Just a follow-up on the Market Me contract question. Mr. Bryan, can you say that the initial contract that was awarded, what was the method of contracting and what was the value of that contract?
So, based on the letter from the National Contracts Commission approving the award of contract, it was an unsolicited proposal which required that a direct contracting was approved, and that approval was granted by the National Contracts Commission on December 2, 2016, and the value of that contract was approximately $15.9 million.
Thank you very much, Pierce. We have follow-ups from Edmond and Zara. We're going to go to Edmond Campbell.
Are you hearing me?
Yes, go ahead, Edmond.
Very well. I was about to ask a question, but you cut me off before I even got the chance to. All right. PS, you indicated that the process was direct contracting for the June 2019 $31 million contract. But I have to ask this question, PS. Isn't it the case that the Ministry of Health, one, has internal public relations and communications specialists? That's one. And two, that the Jamaica Information Service, that they have a public relations department and communications department that provides specialized skills and service in communication and public relations to different government departments and agencies. And the question is, why isn't it the case that either the internal personnel was not used to pursue this particular contract, or the Jamaica Information Service, which has the capacity to do so? And Minister, a quick question to you. Do you have, Minister, any close affiliation with any of the directors of Market Me?
Okay, thank you very much for that question. So the contract, the terms of reference in the contract is not a public relations contract. It's a social marketing behavior change contract. You recall that the core of the Jamaica Moves intervention is around changing behavior as it relates to health seeking activities in terms of proper eating, knowing the status, knowing your health status, and also ensuring that you do the required amount of exercise to keep yourself healthy and reduce the impact of NCDs on the population. So it's not a public relations terms of reference that we were negotiating. It was a behavior change, behavior modification intervention, and therefore those skills are not necessarily readily available, and those are not the skills that we are dedicated to. The second point that I need to raise is that within government we have capacity to do many things. However, there are specific things that need to be outsourced because of the limitations that we have, because dedicated staff have to do multiple things, and when you want to address specific activities, you will have to utilize outsourcing. Now, in some aspects of what we have to do, outsourcing it for consultancy and consulting firms is a agreed methodology, and that is why it is outlined in volume 3 of the procurement guidelines, that you can utilize consulting services for different aspects of the work that the government must undertake. And so that is why we went this route, because of the specialization and because of the social marketing component.
And in terms of my question, Edmond, very, very quick. Yes, I have a great relationship with Market Me. I think they're an amazing company. They have delivered very effectively during my tenure as minister. And I have no difficulty in saying that they work hard, and I have enjoyed working with them.
Thank you very much, Minister. We're going to go to Zara.
Good night again. Mr. Bryan, sorry to hone in on this, but just another quick follow-up. You said a while ago it was an unsolicited proposal for the December 2nd, 2016 contract. But since that time period, and I think you referred to another one in 2019, just forgive me, it's not clear. Are you saying that since COVID-19 began in March, were there any contracts given to Market Me, right? So that's the first one. Second one, just to follow up, at any point did the Minister, Christopherton, recommend Market Me to you as a supplier? That's 2. And then 3, but this one is for the minister. You were saying a while ago, Minister Tufton, that you really, appreciate the work that Market Me does and did. I think the question that Edmund wanted to ask was maybe not answered thoroughly. So I would just want to ask it more directly. Did you cheat on your wife with any of the principals?
No, Minister.
Hold on, no, let me answer.
Minister.
Let me respond. First of all, that's none of your business, and I would prefer you stick to questions around the operations of the ministry. And just as I leave you to your private life, I'd like you to allow me mine. Thank you very much.
All right. So with regards to the contracts given to Market Me during COVID-19, so there was no award of contract that was given to Market Me. However, there were small payments that were made to Market Me for specific activities relating to the communication program around COVID-19, and those those small interventions in terms of this, for example, this evening's engagement is facilitated through the firm, and their remuneration relating to that is paid for through purchase orders. And so that is part one of your question. In terms of part two, the recommendation of market me is not a function of the minister recommending market me. You recall that I outlined that there was an initial unsolicited proposal, and then there was because that contract came to an end, there would be a follow-on contract because the work of the Jamaica Moves program continued. And so it wasn't a recommendation of the minister, it was a function of the preceding contract and then the follow-on contract, which was justified to the Public Procurement Commission and approved by the Public Procurement Commission for the award for the second contract.
All right, thank you very much, PS. We're going to just ask our minister to close. No other questions.
Okay, thank you very much. I would like to take the opportunity to thank all who have participated in this evening's discussion. Minister Mackenzie, I would have wanted you to elaborate a little more. if you want to summarize, then I have no difficulty with that. Maybe you want to summarize what you have said before we close.
I think the general position is that the total participation of every Jamaicans, especially in the various communities where the opening up of the entertainment industry, the round robin, the parties, the tailgate parties. And I just want to make the point, Minister, that nightclubs are not open. There is no order for nightclubs to operate, and I want to make that point. The ban on the operation of nightclubs is still in place. So for the community events, I am urging persons out there, encourage us to extend the period after the 31st of this month.
Okay, thank you very much. So let me just thank the CMO, the PS, for taking on most of the questions this evening. It's the first time we have had a press briefing where the PS has had to take on the majority of questions and not related to COVID. Thank those who came online and asked appropriate questions. We appreciate always your participation, and we will certainly keep you informed as it relates to our COVID update and COVID conversations. Thank you.
The next person in line, your friend at school or your coworker, may have COVID-19 and not know because they have no symptoms. You, on the other hand, could be hospitalized for 2 months or more if you become infected. Is it worth it? Stay socially connected, but keep the physical distance. Stay 6 feet away and avoid a hospital stay. COVID-19 is not over. Protect yourself while protecting others. A message from the Ministry of Health and Wellness.